The prayer this morning will be offered by the good gentlelady from Anne Arundel County.
Let us pray. Father, thank you for every seat that has been filled here today, for each mind and heart that fills the presence of this room. We thank you. Only you truly know what we are setting out to accomplish today. We have an idea, a vision, hints, and daily instructions. We have talents, abilities, and time to work. However, only you can see in perfect detail the end of every beginning, every project, every season, every life. Nothing is ever in vain, for even mistakes and missteps are used for good. Your righteousness transcends all our efforts and understanding. Forgive us for our pride, the pride that puffs up and the pride that threatens our unity. Strengthen our confidence in who you have made us to be. Set us free from comparison in order to work together efficiently. Bless this chamber today. Bless all members and staff who are present, as well as the lives of all we will affect afterward. Ready us to make every moment count. In your holy name, amen.
Amen. Quorum call.
Madam Speaker.
Has everyone recorded their presence? If so, the clerk will take the call. There being 132 members present, the House is now in session. The clerk will read the journal from the previous day.
Annapolis, Maryland, March the 29th, 2023.
Recognizing the Deputy Majority Leader.
Thank you, Madam Speaker. Move so much be considered the reading of the journal.
So ordered. Petitions, memorials, and other papers. Yea and nay, consent calendar number 7. House bills passed in the Senate. Clerk will read the first bill.
House Bill 3.
Recognizing the Majority Leader.
Thank you, Madam Speaker. So much we consider the reading of HB 3 to be considered reading all the bills on the calendar.
So ordered. Message from the Senate. Senate bills introduced in the House. The clerk will read the bills and committee assignments.
Senate Bill 30, Senator Kagan, House Rules. Senate Bill 265, Senator Watson, House Rules. Senate Bill 307, Senator Klausmeyer, House Rules. Senate Bill 906, Senator Roosevelt, House Rules. Senate Bill 931, Senator Hester, House Rules. Senate Bill 240, Senator Gazzoni, House Rules. Senate Bill 959, Senator Benson, House Rules. By Order Sylvia Seeger, Chief Clerk.
Message from the Senate. Senate bills introduced in the House. The clerk will read the bills and committee assignments.
Senate Bill 240, Senator Gazzoni, House Rules. Senate Bill 959, Senator Benson, House Rules.
Report of the Committee on Appropriations, report number 22. Clerk will read the first bill.
House Bill 464, Prince George's County Reentry Employment Incentive Program, funding favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read the next bill.
Senate Bill 48, Disaster Service and Uniformed Services Leave Modernization Act of 2023, favorable.
The question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk will read the next bill.
Senate Bill 156, Prince George's County Reentry Employment Incentive Program, funding favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read the next bill.
Senate Bill 167, Maryland State Arts Council, funding favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read the next bill.
Senate Bill 273, National Capital Strategic Economic Development Fund, annual appropriation and authorized uses, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 425, Maryland Historic Trust, Historic Preservation Loan Fund, Qualified Cooperating Nonprofit Organizations, transfers, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 527, Fire Rescue or Emergency Medical Services Entities, Peer Support Programs, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk will read next bill.
Senate Bill 561, Goodwill Industries of Chesapeake Excel Center in Baltimore City, alterations, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk will read next bill.
Senate Bill 695, State Retirement and Pension System, Military Service Credit, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 756, Access to Counsel in Evictions, funding, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk will read next bill.
Senate Bill 834, State Retirement and Pension System, Administrative Fees, favorable amendments. Amendment number 1.
Madam Speaker.
Recognizing the floor leader.
Thank you, Madam Speaker. So much to be considered, the reading of the amendments.
So ordered.
There is one amendment, and that amendment is technical. Move the amendments.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 886, Higher Education Edward T. Conroy Memorial Scholarship Program, Surviving Spouses of Service Members, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed for third reading. Report of the Committee on Environment and Transportation, report number 29. Clerk will read the first bill.
House Law 1140, Portland Deposit State Historical Park, included areas, favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
HB 11 is in the same posture with the amendments as Senate Bill 517, which we passed unanimously a few days ago. As amended, is an emergency bill that makes several changes related to the establishment of Port of Deposit State Historical Park, including extending the date by 2 years by which the Bainbridge Development Corporation must transfer property to DNR for the park, and authorizing funding for an archaeological survey and soil study. Move the amendments.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. The amendment has been adopted. Question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read the next bill.
Senate Bill 403, condominiums, declarations, and mandatory insurance coverage, alterations. Favor the amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be the reading of the amendments.
So ordered.
As amended, House Senate Bill 403 mirrors the House bill we passed earlier. Amendment number 1 is technical. Amendment number 2 strikes language exempting condominiums consisting of detached units and requirements include certain information about shared improvements to units to a common elements in the declaration. Amendment number 3 requires owners of detached units to carry homeowners insurance on the entire entity. Amendment number 4 makes clarifying changes. Move the amendments, Madam Speaker.
The question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 971, real property recordation procedures. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Environment and Transportation, report number 30. The clerk will read the first bill.
Senate Bill 303, Talbot County Speed Monitoring Systems, intersection of Maryland Route 333, Oxford Road, and Bondfield Avenue. Favor the amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
The amendments conform the bill to HB 700 already passed by this body by striking the authority to use revenue throughout the town of Oxford, not just in the area with the hazardous conditions. Move the amendment.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, the report of the Committee on Environment and Transportation, report number 31. The clerk will read the bill.
Sorry. The wrong one. Senate Bill 830, Environmental Health Specialist and Well and Septic Systems Permitting Studies, Environmental Health Systems Support Act of 2023. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Gentleman from Eastern Shore.
Thank you, Madam Speaker. Could we special order this bill to the end of this session?
Committee Chair?
Sure, that's fine. Just so I can look at it.
Question for the House is to special order Senate Bill 830 to the appropriate time later today.
At the end of this, floor session.
Okay, end of this floor session. All in favor signify by saying aye. Opposed? The bill has been special ordered. Report of the Committee on Health and Government Operations, report number 33. The clerk will read the first bill.
House Bill 363, Maryland Health Benefit Exchange and Maryland Department of Healthcare Coverage for Undocumented Immigrants. Report. Favorable amendments. Amendment number 1.
Recognizing Vice Chair of the Committee.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical. Amendment number 2 requires the study to also include an analysis of offering dental coverage. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. Amendments have been adopted. The question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered. Printed for third reading. Clerk, read next bill.
Senate Bill 806, Maryland Health Benefit Exchange and Maryland Department of Health, Health Care, and Dental Care Coverage for Undocumented Immigrants. Report. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 914, Hospitals Testing for Fentanyl, Josh Seams Act. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Health and Government Operations. Report number 34. Clerk will read the first bill.
House Bill 288, Food Services Facilities Automated External Defibrillator Program, Joe Shea Act. Favorable amendments. Amendment number 1.
Recognizing Vice Chair of the Committee.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 adds co-sponsors, alters the definition of grocery store and the requirements for grocery stores that are subject to the bill, provides that the bill applies to restaurants with an annual gross income of $1 million or does not apply to restaurants with a gross income of $1 million or less, exclusive of sales for off-premises consumption or a seating capacity of less than 100 individuals, requires restaurants and grocery stores that are subject to the bill to register with MIMS, and adds a certain reporting requirement. Move the amendments, Madam Speaker.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. The question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered. Printed for third reading. Clerk, read next bill.
Senate Bill 299, Grocery Stores and Restaurants Automated External Defibrillator Program, Joe Shea Act. Favorable amendments. Amendment 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
These amendments conform the bill with what we just passed a second reader, alters the definition of grocery store and the requirements for grocery stores that are subject to the bill, provides that the bill applies to restaurants, does not apply to restaurants with annual gross incomes of $1 million or less, exclusive of sales for off-premises consumption, or a seating capacity of less than 100 individuals. Requires restaurants and grocery stores that are subject to the bill to register with MIMS, and adds a reporting requirement. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Health and Government Operations, report number 35. Clerk will read the bill.
House Bill 823, Mental Health Law Assisted Outpatient Treatment Programs. Favorable amendments. Amendment number 1.
Recognizing floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 adds co-sponsors and makes technical changes. Amendment number 2 strikes language related to involuntary admissions. requires the Office of the Public Defender to provide representation in assisted outpatient treatment proceedings, alters the criteria for assisted outpatient treatment, and provides that the program is for individuals with serious and persistent mental illness who meet certain criteria, authorizes counties to partner with other counties to establish programs, requires programs to be approved and overseen by the county's local behavioral health authority, requires petitions to be filed in circuit court, requires a care coordination team to develop a treatment plan, allows the respondent the opportunity to voluntarily agree to the treatment plan, and if so, requires dismissal of the case, alters timeframes and notice requirements related to the hearing process, and provides that the respondent maintains any rights normally afforded in a civil or criminal matter, expands the information required in the annual report on programs to include detailed demographic information on individuals, including the services provided and outcomes. Move the amendments, Madam Speaker.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Report of the Committee on Judiciary, report number 36. Clerk will read the first bill.
House Bill 1243, Public Safety, Protecting Against Hate Crimes Grant Fund Establishment. Favorable amendments. Amendment number 1.
Recognizing the committee chair.
Move so much be the reading of the amendment.
So ordered.
Amendment, the committee amendments conform the bill to Senate Bill 840 as was passed by the Senate. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. The question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
Senate Bill 36, Family Law, Grounds for Divorce. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk will read the next bill.
Senate Bill 708, Public Health, Youth Camps, Development Organizations and Programs, Criminal History Records Checks. Favorable.
The question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed for third reading. Clerk will read next bill.
Senate Bill 840, Public Safety, Protecting Against Hate Crimes Grant Fund Establishment. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed to third reading. Clerk will read next bill.
Senate Bill 851, Maryland General and Limited Power of Attorney Act, alterations. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Recognizing Chairman.
Thank you, Madam Speaker. Ask permission to take the members of the House Economic Committee off of the floor for a brief concurrence voting in the old chamber. Thank you.
Okay. ECM Committee, old chamber. Yeah, that would make a whole lot more sense. Report of the Committee on Health and Government Operations, report number 36. Clerk will read the first bill.
House Bill 1249, certified community behavioral health clinics established. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much to be considered the reading of the amendments.
So ordered.
Amendment number 1 adds co-sponsors and makes technical changes. Amendment number 2 conforms the bill to its cross-file by requiring the Maryland Department of Health to apply to the Substance Abuse and Mental Health Services Administration for certain federal planning, development, and implementation grant funds, and by requiring the department to apply to the administration for inclusion in the state-certified Community Behavioral Health Clinic Demonstration Program for fiscal year 2026. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. Amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read next bill.
Senate Bill 8, mental health treatment plans for individuals in facilities and residents grievance system. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read next bill.
Senate Bill 158, pesticides PFAS testing study. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk will read next bill.
Senate Bill 424, eligible projects, procurement of construction materials by Clean Maryland Act. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk will read next bill.
Senate Bill 582, behavioral health care, treatment and access, behavioral health model for Maryland. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Judiciary, report number 37. Clerk will read the bill.
House Bill 307, firearm safety, storage requirements, and youth suicide prevention, Jalen's Law. Favorable amendments. Amendment number 1.
Madam Speaker.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
The amendment conforms House Bill 307 to its cross-file Senate Bill 858, which we voted out. Move the adoption of the amendments, Madam Speaker.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Report of the Committee on Judiciary, report number 38. Clerk will read the first bill.
Senate Bill 21, criminal law, person in a position of authority, sexual offenses with a minor. Favorable amendments. Amendment number 1.
Madam Speaker.
Recognizes Chair of the Committee.
Move so much be the reading of the amendments.
So ordered.
The committee amendments conform the bill to House Bill 226 as passed by the Senate. Move the amendments.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Ways and Means, Report number 29. Clerk will read the bill.
Senate Bill 720, Horse Racing, Extension of Maryland Horse Racing Act and Establishment of Maryland Thoroughbred Racetrack Operating Authority. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Ways and Means. Report number 30. Clerk will read the bill.
Senate Bill 913, Education, Community Eligibility Provisions, Schools, and Pre-Kindergarten Enrollment and Funding Alterations. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. So much to be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical. Amendment number 2 delays the date by which schools are required to collect a form to provide alternative measure of poverty and specifies the content of the form. Amendment number 3 amends requirements for assistant principals under the blueprint for Maryland's future career ladder and clarifies the date on which certain requirements under the career ladder go into effect. Amendment number 4 requires that certain children whose families earn between 300 and 600% of the federal poverty level be eligible for enrollment in publicly funded pre-kindergarten programs in the 2023 and 2024 school year and be counted in certain manner under certain funding formula. And Amendment number 5 adds a school counselor to the membership of the Maryland Consortium on Coordinated Community Support. I move the committee amendments, Madam Speaker.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Oh, the re-refer. Okay. Clerk will read the next bill.
Senate Bill 696, Prince George's Gateway Development Authority, established, re-referred to Environment and Transportation.
Report of the Committee on Economic Matters, report number 26. Clerk will read the bill.
Senate Bill 516, Cannabis Reform. Favorable amendments. Amendment number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. So much to be considered the amendments.
So ordered.
We only have 2, Madam Chair. Amendment number 1 is technical, or Madam Speaker, hilarious. Amendment number 2 restores the House language on disproportionately impacted areas, changes the local funding distribution from Community Reinvestment and Repair Fund to refer to possession charges, not arrest, provides for social equity partnership grants to operational licensees, authorizes dispensaries to repackage cannabis subject to certain requirements, prohibits indoor smoking on on-site consumption facilities, includes dispensaries in the definition of social equity licensee, provides for delegation of hearing within the administration, requires the administration to adopt regulations on the packaging and labeling cannabis and packaging and repackaging of cannabis by dispensaries and on internet sales, restores House language on medical licensees who choose not to convert, authorizes existing dispensaries to continue delivery services to patients through July 1st, 2024, provides a percentage-based conversion fee for existing licensees based on gross revenues, sets initial and renewal license fees for standard licenses, requires an out-of-state social equity license applicants to provide certain documents, refines language on the second and subsequent rounds of licensees, provides food to ratio receipts criterion on on-site consumption facilities, requires at least 25% of dispensary products to be from social equity and non-affiliated licensees, clarifies provisions on advertising and regulation, requires testing of hemp-derived tincture before their sales, provides 50% of the county's shares of the sales tax collected from a dispensary in a municipality to be distributed to that municipality, explicitly adds startup and capital funding for social equity licensees to the priorities for the funding of the Cannabis Business Assistance Fund, allows administration to quickly procure communication services for public outreach on cannabis laws, regulations, and potential safety risks, allows existing growers to apply for a standard dispensary license, authorizes the governor to transfer the administration's to the administration certain budgeted funds from ATC's fiscal year 2024, requires ATCC and the administration to enter into an MOU, and makes other conforming and clarifying changes. Please move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Recognizing the gentleman from the Eastern Shore.
Thank you, Madam Speaker. So as we all know, we've talked about this bill quite a bit, and I think it's fair to say we voiced some of our concerns. One of my concerns is the distance, the establishment of the 500 feet distance from a cannabis facility to a school. So, you know, people, if you think back to our days, alcohol was the big thing when we were kids, and people tell me that, you know, if you were under the legal age, you would use somebody else to maybe go and make that purchase for you. I'm getting some nods out there. Some people can relate to that. So might as well put the amendment forward. So I have an amendment at the desk, amendment number 6533201.
Amendment number 1.
Thank you. And the amendment's simple. I'm not even going to ask to abbreviate it. On page 66 in line 13, strike 500 feet and substitute a mile. So seeing that I have some people, a mile, some people, you know, relating to my story, we certainly didn't have people, at least I don't think we had people carrying a six-pack in the school, but when we think about what can be purchased at the cannabis shop, we take a pen, half the size of the pen could be a cartridge with cannabis. So this amendment, I think, would eliminate a lot of concerns. We have folks walking to school, maybe a high school, and having somebody stand in front of a cannabis shop, asking somebody to make a little purchase, a purchase half the size of the pen, and be able to take that into school. I think all of us can agree the last thing we want in our schools, especially our high schools and so forth, is somebody being able to bring marijuana in and make it so accessible as the walk to school would include a walk past that cannabis shop. So for those reasons, Madam Speaker, I ask you to move the amendment.
Chairman of the committee.
Thank you, Madam Speaker. Would the maker amendment please rise for a few questions? This is for purpose of clarification. Is your intent today, by moving this amendment, to state that we cannot have any marijuana facilities within a mile of a school, correct?
School
or daycare, correct? A licensed daycare,
correct.
Or family child care center, or playground, correct?
Correct.
Or recreational center, correct? As the bill's reading. Or library.
Or library. That one.
Yes, so that's your intent, to make sure that we can't have any marijuana dispensaries around schools, primary and secondary, licensed daycare, family daycare, any playground, any recreation center, and any library or public park. Is that the intent of your amendment?
I would say that's fair.
So fair to say, in Ocean City, we just did a little research, we couldn't put a dispensary anywhere in Ocean City because there's nowhere that spans a mile between any of these things.
I can't tell you I'm heartbroken by that.
I understand that, but the citizens of the state might be, because again, we're doing their bidding. they asked us to do this. They asked us to do this in a fair and equitable way. They asked us to make sure that we did not stick them all in one place, and to make sure anybody and everybody who wanted to imbibe does have access. But by what you're asking me to do, you're limiting, I would say, to maybe 8 or 9 spots in this state that we could ever have a dispensary, because there's always one of these facilities, a school, family daycare, library. Again, this is the opposite of the intent of what this General Assembly is trying to do, which is take this out of the illegal stream of commerce. Because by doing that, you're creating a huge vacuums where there can be no dispensaries. And believe me, if we don't do it, somebody else will, and that's what the last 30 or 40 years have proven in the laughable war on drugs. The job of this body is to make sure we protect our citizens. They have to be spread out, they have to be fairly placed, but this amendment basically limits access to almost nowhere in Maryland. So for all those reasons, I would ask that we please just vote red on this amendment.
Maker of the amendment.
Thank you, Madam Speaker. So the intent of the amendment is to protect our children and keep our families safe. Thinking about what you said about in Ocean City, I know Ocean City pretty well, and for your assertion to say that there wouldn't be a facility available anywhere in Ocean City, if the floor leader could rise.
Yes, sir.
Chairman of the committee.
Thank you. So your assertion that there wouldn't be a facility anywhere in Ocean City if this were to be applied, I kind of find that hard to believe with where we have a library. I'm thinking of our parks. I'm thinking about our daycare facilities in the incorporated limits of Ocean City. That's unfortunately those services, there aren't many. So, I would think with the geography of the majority of our state, that if this amendment were to pass, there would still be plenty of opportunities based on the number of licenses that are going to be administered so that we could properly fulfill the bill. So for those reasons, Madam Speaker, I'd like to push the amendment.
Chairman.
I guess that was a question, but I'll take it. So my point was, we actually did the research and read the bill, and it wasn't just for schools. And I understand the intent of the bill, which is why we require them to card, and I understand there's no perfect system. But to be very clear, these all overlap. I don't know if you know how big a mile is, but it's pretty big. And for you to say that it's got to be a mile from a playground, recreation center, library, or public park, in addition to primary and secondary education, you're not leaving us a lot of space here. Maybe way out in the country, but remember, we want them accessible. And if it's way out in the country, who's going to go out there to get them? Not if they can just go to the corner. Right. So what we're trying to do is avoid people from going to that street corner. We want them to go, and there's just not that many places in Maryland if your amendment was to pass. I do understand your intent, but I think you missed the mark. So for all those reasons, I would ask that we oppose this amendment. Thank you.
On the amendment, all in favor signify by saying aye. Opposed? Roll call.
Madam Speaker.
Clerk will take the call. The amendment fails. Are there any additional amendments to the bill or to its title? Gentleman from Baltimore County.
Thank you, Madam Speaker. I have an amendment at the desk. The amendment number is 243129/1.
Amendment number 1.
Please move waiving reading of the amendment.
So ordered.
Thank you, Madam Chair. Madam Speaker, I'm very sorry. It was all his fault. All right. Anyway,
go ahead, complete. Finish.
I think this is a friendly amendment, and this would outlaw someone while they're driving in a car with a minor child in the car smoking or vaping marijuana. Given the cars being closed up, I've had it witnessed that unfortunately people bringing their kids to school, the doors open up and all this smoke comes out. Now, these kids have to go to school like that, and I'm just giving you an example. These children have to go to school after inhaling these vapors, and I believe there was a secondary high. I've never been in that situation, but I would just say that, we want to protect our children. And anyway, this, I think is a friendly amendment. I would ask the floor leader to accept my amendment. Thank you.
Committee Chair.
Colleagues, I would ask that we reject this amendment. I understand the idea. To make it clear, it's already illegal to drive and smoke marijuana in the state of Maryland. You can't do it. And secondly, and I'm more to the point, I'm the chair of House Economic Matters, not Judiciary. This is where bills come to die. He could have brought it, but he didn't. And at the end of the day, this is a business regulation bill. That's what we do. I would not take the good chairman's responsibility from him of locking people up. My job is to make sure that these businesses can run smooth, make sure that when we get this up and running, that it's fair and equitable. Nothing in this bill is about criminal law. That's where our chairman from the other committee, or band of thieves, as they may call it, comes in at. Oh, band of pirates, I apologize. But I would say again that you're putting this in the inappropriate place. This is definitely a law for another year because this is a licensing bill. Everything we're doing has to do with the licensing of cannabis. Now, there are penalties for improperly, utilizing your license and selling outside your license, but nothing to do with the criminal law system. That has more to do with the other committee. So again, for those reasons, I would ask that y'all reject this amendment.
Madam Speaker.
Chairman of the Judiciary.
I completely support the chairman's position. Thank you, Madam Speaker.
Madam Speaker.
Minority Leader.
Thank you, Madam Speaker. Either one of the two esteemed chairmen from the committee that locks them up and the committee that lets them go, if either one of you wants to stand up, that's perfectly fine. But in response to what my friend from Charles County just said, that it's illegal for someone to consume cannabis while driving, my understanding of my friend from Baltimore County's amendment is what it relates to is this. You're not the driver, you're a passenger. There's a 3-year-old or a 5-year-old or a 9-year-old sitting in a car seat in the back of the car, and you are smoking marijuana to your heart's content because you're not driving the car. Huff, huff, pass, pass, fumes go around. I don't know what people's commonality experience is with that, but I would suggest that it has an intoxicating effect, a deleterious effect on children. There's a kid in the back seat of the car, and your passenger smoking marijuana. Will someone answer that question for me? Is that illegal in the state of Maryland today, or is that cool? Anybody? Anyone from the Judiciary Committee, the Economic Matters Committee, from up in the gallery? Can you tell me, is that cool to smoke marijuana in the car? Not a criminal penalty at all. I can smoke marijuana, I can expel the fumes, I can do it all, and I got a 4-year-old sitting in the back seat of the car. Is that cool? Because if it's not cool, vote for the amendment. And that will make sure that everyone knows that's not right, that's not cool. It's that simple. Thank you, Madam Chair. Madam Speaker.
Gentleman, maker of the amendment.
I would like to press this amendment. This is for the children. I mean, I witnessed it with my own eyes. They pull up to the school, they let the kid out, and here comes all this smoke. Now, this child has to go to school and learn after being subject to marijuana. It would be kind of funny, but this is a fact. It's heartbreaking knowing that our children have enough difficulties at school. We don't need to burden them with even more. And I would press this amendment, and I think it is appropriate because this has to deal with marijuana. And I would ask this body to vote for this amendment. I think it's for the children. We have to. Thank you.
Chairman of the committee.
Thank you, Madam Speaker. Again, I do appreciate the intent of the maker of this amendment, but as I said, this is the wrong vehicle for this amendment. This is a licensing bill. This sounds like something that should have had a hearing. This is very important, and as such, I hope that next year you do put a bill in the proper committee so we can get this properly addressed and vetted. Thank you very much. I ask that you resist the amendment.
Gentleman, still pushing your amendment?
Yes, Madam Speaker, and we're going to wait a whole year and let these children be in a vehicle while parents or passengers smoking, vaping, or whatever. That's unconscionable. We're down here to protect the children and our constituents, and I stand here today that I'm pressing this amendment, and I believe this is the vehicle. we must pass this and, bring back a bill. We're talking about a year. So, I press my amendment. I would ask this body to please support this amendment. Thank you, Madam Chair.
On the amendment, all in favor signify by saying aye. Opposed? Roll call.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. The amendment fails. Are there any additional amendments to the bill to its title?
Madam Speaker.
Gentlelady from Baltimore County.
Thank you, Madam Speaker. Will the floor leader rise, please?
Yes.
Thank you so much. This is an important bill, and I supported the House bill when it went over because I know that this is an issue we have to deal with, that promises were made that recreational marijuana would be available July 1st. So I appreciate the hard work that's gone into this, but I have some questions for possible amendments on third reader. So if I'm not mistaken, we adopted the medical cannabis law in 2016. There wasn't anything in law or regulations that ever told a prospective licensee before they invested millions of dollars building their businesses, buying their property, that one day we would force them to convert to a recreational marijuana license or lose their business. Is that correct?
That's correct.
So why are you forcing licensees to convert?
They don't have to.
Well,
they have to actually pay a fee. They don't have to.
That's a good one. If they don't convert, they go out of business.
I don't know if they go out of business, but they don't have to convert. I would never do that.
That may be a distinction without meaning. I'm concerned that we require prospective licensees to prove they had land for their facilities, financial means to take on the responsibility of developing a business as a grower, processor, or dispenser, and then we required a substantial license fee in order to be approved. Is that correct? We set up some pretty tough, strict guidelines for these current licensees.
Tough but fair.
Tough but fair. Wouldn't you call that agreement between the state and the business that became a medical cannabis license? That was the agreement that the state made with the licensees. You do these things and we will grant you a license.
Correct.
By statute and administrative action, we established a framework for the licensee, and if the licensee did everything we asked, they were granted a license to operate under those terms. Is that correct?
Yes.
And there are nearly 20 growers, close to 100 dispensaries that relied on these statutory terms and conditions, and in reliance of that, they made investments of tens of millions of dollars to grow this medical cannabis business in the state. Is that correct?
That I don't know. I'm depending on where they are there. Yeah.
We know collectively that the industry has put in tens of millions.
And made even more. But yes, go ahead.
Yeah, and maybe more. Thank you.
I said made even more.
What troubles me now is we're changing the rules that we agreed to when each side, the state and the licensees, did what we required them to do. It's my understanding that if a medical licensee does not convert to adult use, they will be forced to cease operations on July 1st. Is that true?
They will no longer be licensed for medical use, correct?
So yes, they'll go out of business because they can't sell in another state. That's illegal federally. Now, under this bill, we're saying to existing medical licensees who spent millions that we're changing the rules on them. Do you not see it that way?
As far as I'm changing the rules.
We're telling them that you did all these things, we put these requirements. Now, if you don't convert, we're going to essentially close their business.
I guess what you're saying is because we have moved to a recreational marijuana industry. We no longer have a medical marijuana industry. And I think you're confusing a privilege for a right, because that license was not a right, it was a privilege. It's not a property right. So and to double down on that, the amount of money that they have made, if the investment you say is true, is more than made up for that. And thirdly, if they choose not to operate in this space, and they choose, they wanted to sell medical marijuana, but they no longer want to sell recreational marijuana, then again, because it's a right, not a privilege. Excuse me, it's a privilege, not a right. Sorry. Then they will have an extraordinary amount of value in that business that they have. And while they can't operate the business because we no longer have that business, there cannot be an expectation that, well, I still want to sell medical marijuana for like, yeah, but there's no such thing as a medical marijuana program anymore. We have done away with that business. We've allowed them to convert or to sell their business.
So some would call that a taking because they've invested. There's a contract. There's an agreement. Look, that we, all of us on this floor, were disappointed with the rollout of the medical cannabis program. It was an important program that I supported, you supported, many of us supported because we know the value and positive health benefits for medical cannabis. And we made an agreement with these folks. And some of them have not made money. Some of them are barely holding on and are not making money. They've invested tens of millions of dollars, they and their investments. So it seems unconstitutional to essentially take away a lawful business enterprise simply because someone does not choose to enter into the adult use market. And that condition was never expressed in the medical cannabis legislation when we passed it, and they subsequently invested millions into their business. Can't you see that the difficult position that we're putting business owners in by this forced conversion?
I find this entire argument hilarious in that the fact that every person I know that got involved in medical marijuana did so with the speculation that we will one day have recreational marijuana. Any investment they made was to ensure, and they grew and they built out way more than some of them than they should, because they figured one day we were going to have recreational and that's when they were going to blow up. So I've never heard this argument before. I'm listening. I don't see it. Again, it is not a right, it's a privilege, and any state has the right to say we are no longer doing this program. We've done it before, we'll probably do it again. So if they didn't want to participate, if we chose to just end medical marijuana, period, it's still not a right, and it's definitely not a taking because it's not a right.
I would respectfully disagree and also talk about contract law with the contract that the state made with these licensees. What contract do you think they signed with the state? Well, the license agreements that were made.
Those aren't in perpetuity. They all have to be renewed. So to say somehow because you agreed with a state or government agency at one point in your life that forever in that day that you will always have that privilege, that's not law either.
Yes, but you know that the sudden stop at the end of the road on July 1st is also difficult. I'd like to ask you about the moratorium. And the moratorium and the way it's written in the bill. Correct me if I'm wrong, but it seems to me the medical cannabis licensees have already complied with one moratorium, and now we're putting a second 5-year moratorium on them. Can you tell us about the initial moratorium and now?
I cannot. I wasn't there to pass that bill. I don't know about a moratorium. I do know that we put a moratorium on individuals who are going to be converting over to the recreational cannabis to make sure that we don't have the issue that many other states have where we they get the license, they're lucky enough they have good lawyers, and the first thing you do is flip it and sell it because we don't want large MSOs dominating our market. We wanted small Maryland business to do that. We wanted people to invest in this market who are going to be in this market, not as speculators but as growers, because either we get behind it or we don't, and that's how we chose to lay it out to ensure these individuals, especially with the equity license and things of that nature, that they don't luck up and get a license and then hope to just flip it, because that does not create a sustainable market.
I appreciate your motivation there, but I would contest that, and there may be amendment on this on third reader, that licensees who entered into an agreement and agreed to or were forced to a moratorium on selling their business, now there's a double jeopardy, yet another moratorium
Only
on
if
them.
they choose, by their own volition, if they agree to go into the recreational market. There's nobody here Nobody you've talked to that's being forced to enter into the recreational market. That is their choice, knowing the cost, knowing the agreement, and how much they have to pay. That is merely their choice.
That's a great argument from my good friend and attorney. As I said yesterday, I'm not one, I just play one here at work. And I learned good arguing skills from people like you, but telling them they don't have to convert or go out of business is, a false assumption that they would be like, oh, I'll just go out of business.
One program is ending, another's beginning. They either can jump off the train or they can get on the new one.
Here's another concern. Existent licensees who are currently free to sell interest in their businesses and raise capital in the equity markets would now be prohibited from doing so. The restriction on transfer of ownership in this bill would treat publicly traded and privately held companies differently. We recognize our inability to restrict in a substantial way any publicly traded licenses on the Canadian stock market or exchange elsewhere. But all private held licenses are prohibited from accessing these capital markets. And that's not an equal treatment. What do you say to that?
I say that throughout the state, throughout the nation, we've watched these programs be developed for medical and recreational marijuana. We've watched predatory investors come in to these small businesses and say, no, we'll take care of you. And at the end of the day, in the moment they, just like in New Jersey and Florida and all these other places, and as soon as they make a misstep and they sign the wrong document, they no longer own a business. And again, the goal is to protect Marylanders and ensure that they're not being taken advantage by these large out-of-state businesses who are crafty and know this way better. They have way better lawyers than I'll ever be. Getting these individuals, because they're short in capital, to take that money and immediately dominate, take over their business. It happened in New Jersey. They lost almost all their minority dispensaries because of predatory investors. So the goal is protect it, and again, keep it in Maryland, making sure that anybody who is a licensee is protected and not dominated by this industry. So that's how we limited the investment.
I appreciate that. I think we all want to grow Maryland companies. And encourage Maryland-owned businesses. Absolutely not allow multi-state operators to come in and dominate as they've done in other states. But I would also argue back to my previous point that this 5-year moratorium is going to hamstring them on getting capital to grow their business. But my last question would be on advertising. And I heard one of your amendments when you stood to talk about advertising. It's how can we restrict a business from advertising or displaying their name? So I completely understand restrictions on content. We don't want, pictures of people hotboxing, come on up, get your marijuana here. I think we put limits on flower, like there can't be giant billboards with marijuana flower, buds on there, come here to buy your marijuana. But it's my understanding that the amendment actually limits the use of someone's name. Is that true?
As far as where and when they can advertise it? Because you can put it on your building if that's what you're asking.
I'm sorry.
You can put it on your building. You put your name on your building. We make sure that you can have the signage on your building. What we're trying to do is I don't know, so let's say I'm a dispensary, Pot Haven. What I don't want to see all over my community is Pot Haven signs. Or Weedville. I don't want to see those either. And if the O in your name has a pot leaf on it, I don't want to see that either. I don't think the citizens want to see it. So what we've done is, for respect of our community, and we watched how it was done in the medical market, where they were putting the signs in the middle of the roadways and all that. Maybe you didn't see it, but in my community, it was all over the place.
I think it was all across the state.
Right.
So,
and so to prevent that, we said, no, you don't get to advertise. You don't need to advertise. You don't get to advertise. They've limited time and time again advertising of liquor, cigarettes, things of that. We're doing the same thing.
Sure, but a name that doesn't have a pot leaf on it, or someone builds a brand for a store and it doesn't have advertising effects of promoting something that we might. If the name of the store was Wilson's Health Alternatives, why wouldn't we let somebody put on a billboard Wilson's Health Alternatives?
Because we don't get to make people choose a name. So if they said Wilson's Pot Emporium, I couldn't say yes to Wilson's Health Alternatives, but no to Wilson's Pot Emporium.
So possibly there could be an amendment to allow a name to be used as long as it wasn't Wilson's Pot Haven,
or
but it could be
or Puff Puff. I mean, so just how much of that? How many different denotations will we have in that amendment to ensure that we are doing this in good faith?
Well, I think you're super smart. I think we could come up with something together that would certainly protect people to be able to use a name that they've grown their name, because look, we know, you say Walmart, everybody knows who you're talking about. So, the value of branding on a name is huge. And I think in some ways this restricts that commerce and also their First Amendment.
And I guess we have this big versus small take idea, because I don't know any of the small businesses. Walmart, yeah, I'm sure all those big businesses you're talking about, Pepsi, they're frustrated over this. But the mom and pop stores aren't. They don't want to put Jan's Boutique and just assign it with no description, because nobody would know what it is. They're not going to invest in advertising with just their name. It's a common, but Walmart will. You're right. The big MSOs, the people you're talking about that you're supporting this amendment, or the amendment you're putting in, the big money people, yeah, they want to get their name out. They want to dominate the industry by, like you said, putting their name on billboards, like Scotch tape versus clear tape. That's how they want to be known in the marijuana market. That's what we're trying to prevent.
Yeah, I guess I would tell you Papa John's Pizza, or not Pizza John's, for my friends from East Baltimore County. Pizza John's is a small family business, and they put that on their billboards, and we all know what pizza they're talking about, and it's fantastic.
They don't put anything else but Pizza John's.
They are not a big company, and that comparison would be, perfect. Sure, I shouldn't have used Walmart. I should have used Pizza John's. So,
Does Pizza John's sell marijuana? No, they sell pizza, don't they?
No.
See, it's in their name. That was my whole point.
It could be Wilson's Healthy Alternatives, and that would be a place that you could go to, a dispensary, and that's a great name, and this bill, the way it's written, would prohibit you from putting a billboard up that says Wilson's Healthy Alternatives. So with that, thank you, Madam Speaker, for indulging me, and thank you, Chair, for answering my questions.
Is there any other debate?
Madam Speaker.
Yes.
Would the floor leader rise, please? Good morning.
Sure.
How are you, sir?
Good morning.
Just a point of clarification. So you just made a point that the medical marketplace is going away. So will this reform bill completely eliminate the medical marketplace in Maryland?
No, but it will not be. There will not be a store that sells medical marijuana only.
Sure.
Or a grower that provides medical marijuana, or a processor that processes only medical marijuana.
Okay.
So all of our stores all of our adult use stores will also have medical marijuana.
Okay. So there still will be a medical marijuana marketplace in Maryland?
No, there will be people that have a medical marijuana card that
Right.
can go buy recreational or medical marijuana at a recreational facility.
Okay. But there still will be medical marijuana card holders in Maryland?
Mm-hmm.
Okay. So to my good delegate's point, right, there is still going to be a medical marijuana marketplace in Maryland. My wife and I have a business where we certify people for medical marijuana, and we take care of a lot of kids, for instance, that have cancer and things like that need medical marijuana cards that would not be able to access this without a medical marijuana card, in the new model.
Correct.
So I think her point is well taken, in that there is absolutely still going to be a medical marijuana marketplace here in the state of Maryland, and we are causing these companies that have a medical marijuana marketplace now that exists in that marketplace to function in a different way come July 1. I think that there is a reasonable argument there, and I think my colleague makes a reasonable argument that is a taking for those businesses that are still going to exist in the state of Maryland. There is still going to be a medical marijuana marketplace in Maryland.
And I guess you're saying that the argument is to let them go ahead and just to continue to sell only medical marijuana. Is that I guess that's where we're going with this?
Sure. I think there is going to be a marketplace for pediatric patients. I think that there's a marketplace for patients that are in that gap period there between 18 to 21.
And they will all be able to come to every recreational. We ensure that every recreational store has set aside time, hours, lines, things of that nature, and that they have to provide for those individuals in need.
Which I think that's fantastic. I think that's great. But to my colleague's point, there is still going to be a medical marijuana marketplace in the state. And we are fundamentally changing the agreement that we put in place with those companies just a few years ago in 2016.
And again, when you say the word agreement, I'm not really sure what you mean. They signed up for a license. They got a license. That license is going away. I'm not sure what agreement. I know there was nothing in perpetuity. And I granted, didn't read it, don't know, but I'm sure it didn't say in perpetuity because you have to even renew your license. So I don't know the agreement you're talking about, or maybe you're talking about an expectation.
So I think there is a bit of an expectation for sure, right?
Yes.
When you create a business.
But that's different than an agreement between two parties. An expectation is a single party.
Well, I would say that the expectation occurs based upon the agreement here. When you are operating in a legal way, when you're investing millions of dollars into a business model, and to your point, for sure, there are absolutely companies that were operating knowing that a recreational marketplace was going to exist. However, I don't think that was every company. I don't think that that's everyone inside of that marketplace. I know many of these folks inside of that marketplace. I don't believe that that's everybody there. So I do think that this is frankly a taking for those companies that are operating that way. And with that, I'll yield my time, but I just wanted to make that point.
Sure thing.
Is there any further debate? If hearing none, Senate Bill 516 is ordered past the third reading.
Sorry, Madam Speaker.
Yes, recognizing the chairman of appropriations.
Thank you. Can we pull the Appropriations Committee off the floor for 5 minutes to vote on a couple of bills?
Yeah, you want in
Old House Chamber.
Old House Chambers.
Perfect. Thank you.
Corporation, Old House Chambers. Report of the Committee on Ways and Means, report number 32. Clerk will read the first bill.
House Bill 84, Maryland Nonprofit Development Center Program, Nonprofit Interest-Free Micro Bridge Loan Account Funding. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Bills must be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical. Amendment number 2 requires in either fiscal year 2024 or 2025 an appropriation of $1 million to the Maryland Nonprofit Development Center Program Fund for the Nonprofit Interest-Free Microbridge Loan Account and repeals a discretionary distribution to that account. Move the amendments.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. Amendments have been adopted. Question now to adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read next bill.
House Bill 599, Property Tax Credit, Public Safety Officer. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read next bill.
Senate Bill 53, Maryland Nonprofit Development Center Program, Nonprofit Interest-Free Micro Bridge Loan Account Funding, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed to third reading. Clerk, read next bill.
Senate Bill 721, Income Tax Credit for Federal Security Clearance Cost Alterations, favorable.
The question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed to third reading. Report of the Committee on Rules and Executive Nominations. Report number 6. Clerk will read the bill.
Senate Joint Resolution 5, locating the new Federal Bureau of Investigation headquarters in Maryland, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed to third reading. Report of the Committee on Environment and Transportation, report number 32. Clerk will read the first bill.
Senate Bill 491, Charles County Task Force to Study School Bus Operator Contracts and Wages, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed to third reading. Report of the Committee on Rules and Executive Nominations, report number 8. Clerk will read the first bill.
House Bill 1301, State-Owned Nursing Homes Deficiencies, Citations, and Fines Contractor Reporting Requirements, re-referred to Health and Government Operations.
Clerk will read next bill.
Senate Bill 974, State-Owned Nursing Homes Deficiencies, Citations, and Fines Contractor Reporting Requirements, re-referred to Health and Government Operations.
Quorum call.
Madam Speaker.
Has everyone recorded their presence? So the clerk will take the call. There being 136 members present, the House is still in session. Calendar of third reading, House Bills number 102. Clerk will read the first bill.
House Bill 138, Study on Statewide 211 and 311 Systems.
Is on third reading and final passage. Is there any debate? If not, the clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 139 votes in the affirmative, House Bill 138, having received the constitutional majority, is declared passed. Clerk will read next bill.
House Bill 197, Washington County Sheriff's Salary Alteration.
Is on third reading and final passage. Is there any debate? If not, the clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 140 votes in the affirmative, House Bill 197, having received the constitutional majority, is declared passed. Clerk, read next bill.
House Bill 371, Recordation Tax Authorization for Counties to Exempt Indemnity Mortgages.
Is on third reading and final passage. Is there any debate? If not, the clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 140 votes in the affirmative, House Bill 371, having received the constitutional majority, is declared passed.
Madam Speaker.
Gentleman from Baltimore County.
Sorry, my button didn't work. I'd like to record in the green for House Bill 138. Thank you.
Any other vote changes? What? Decent? Concurrence?
Okay, which one is the?
Concurrence calendar number 10. The clerk will read the bill and the Senate amendments.
House Bill 322, Public Health, Home and Community-Based Services for Children and Youth, Amendment Number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur in the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 322 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 138 votes in the affirmative, House Bill 322, having received the constitutional majority, is declared passed. Clerk, read next bill.
House Bill 614, Department of Aging, Long-Term Care and Dementia Care Navigation Programs, Amendment Number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
The question for the House is to concur in the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 614 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There will be 140 votes in the affirmative. House Bill 614, having received the constitutional majority, is declared passed. Concurrence calendar number 11. The clerk will read the bill and the Senate amendments.
House Bill 874, Office of the Attorney General, Environmental and Natural Resources Crimes Unit Establishment, Amendment Number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur in the Senate amendments.
Question for the House is to concur in the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 874 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 103 votes in the affirmative, House Bill 874, having received the constitutional majority, is declared passed. Concurrence calendar number 12. The clerk will read the bill and the Senate amendments.
House Bill 923, Higher Education, Appointment of Secretary and Student Financial Assistance, Accommodations at Public Institutions for Religious Beliefs, Amendment Number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur in the Senate amendments.
Question before the House is to concur in the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 923 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. House Bill 923, having received a constitutional majority, is declared passed. Clerk will read the next bill.
Concurrence calendar number 13, House Bill 261, Public Projects, Procurement of Construction Materials by Clean Maryland Act, Amendment Number 1.
Madam Speaker.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur in the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 261 is on third reading and final passage. Clerk will call the roll.
Madam Speaker?
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 106 votes in the affirmative, House Bill 261, having received a constitutional majority, is declared passed. Clerk will read the next bill.
House Bill 571, Opioids, Opioid Restitution Advisory Council and Fund and Overdose Response Program, Amendment number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur in the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 571 is on third reading and final passage. Clerk will call the roll.
Madam Speaker?
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 140 votes in the affirmative, House Bill 571, having received a constitutional majority, is declared passed. Clerk will read next bill.
House Bill 676, Cemeteries, Pet Remains, Duty of Perpetual Care, Amendment number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 676 is on third reading and final passage. Clerk will call the roll.
Madam Speaker?
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 139 votes in the affirmative, House Bill 676, having received a constitutional majority, is declared passed. Clerk will read next bill.
House Bill 816, Procurement, Minority Business Enterprises, and Veteran-Owned Small Business Enterprises Participation Goal Scorecard.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 816 is on third reading and final passage. Clerk will call the roll.
Madam Speaker?
Has everyone recorded their vote? Does anyone care to change your vote? If not, the clerk will take the call. There being 139 votes in the affirmative, House Bill 816, having received a constitutional majority, is declared passed. Concurrence calendar number 14. The clerk will read the bill and the Senate amendments.
House Bill 687, Estates and Trust Decanting, Maryland Trust Decanting Act, Amendment number 1.
Recognizing the committee chair.
Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 687 is on third reading and final passage. Clerk will call the roll.
Madam Speaker?
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 139 votes in the affirmative, House Bill 687, having received the constitutional majority, is declared passed. Concurrence calendar number 15. The clerk will read the bill and the Senate amendments.
House Bill 2, Income Tax Subtraction Modification, Union Dues, Amendment number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur in the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 2 is on third reading and final passage. Clerk will call the roll.
Madam Speaker?
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 104 votes in the affirmative, House Bill 2, having received a constitutional majority, is declared passed. Clerk will read the next bill.
House Bill 535, Election Law Ballots, Issuance, Processing, and Reporting Procedures, Amendment Number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Aye. Opposed? The ayes have it. House Bill 535 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change your vote? If not, clerk will take the call. There being 100 votes in the affirmative, House Bill 535, having received a constitutional majority, is declared passed. Clerk, read next bill.
House Bill 551, Office of Statewide Broadband Study of Broadband Expansion Incentives, Amendment Number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Aye. Opposed? The ayes have it. House Bill 551 is on third reading and final passage. The clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change your vote? If not, the clerk will take the call. There being 138 votes in the affirmative, House Bill 551, having received a constitutional majority, is declared passed.
Madam Speaker.
Yes.
Hi, my finger didn't work for HB 535. I would like to be recorded in the green, please.
Concurrence calendar number 16. The clerk will read the bill and the Senate amendments.
House Bill 448, Non-Public Education, Placements of Children with Disabilities, Teacher Salaries, Teacher Pay Parity Act, Amendment Number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur in the Senate amendments. All in favor signify by saying aye. Aye. Opposed? The ayes have it. House Bill 448 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change your vote? If not, the clerk will take the call. There being 138 votes in the affirmative, House Bill 448, having received a constitutional majority, is declared passed. Concurrence calendar number 17. The clerk will read the bill and the Senate amendments.
House Bill 424, State Retirement and Pension System, Non-Vested Accounts, Regular Interest, Amendment Number 1.
Recognizing the committee chair.
Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Aye. Opposed? The ayes have it. House Bill 424 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change your vote? If not, the clerk will take the call. There being 140 votes in the affirmative, House Bill 424, having received a constitutional majority, is declared passed. Clerk, read next bill.
House Bill 502, Department of Human Services, Electronic Benefits Transfer Cards, Theft of Benefits, Prevent Electronic Benefits Theft Act of 2023, Amendment Number 1.
Recognizing committee chair.
Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Aye. Opposed? The ayes have it. House Bill 502 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change your vote? If not, the clerk will take the call. There being 128 votes in the affirmative, House Bill 502, having received a constitutional majority, is declared passed. Clerk will read next bill.
House Bill 541, State Retirement and Pension System, Earnable Compensation, Non-Vested Former Members, and Immediate Vesting, Amendment Number 1.
Recognizing the committee chair.
Move to concur.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Aye. Opposed? The ayes have it. House Bill 541 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change your vote? If not, the clerk will take the call. There being 140 votes in the affirmative, House Bill 541, having received a constitutional majority, is declared passed. Clerk will read the next bill.
House Bill 803, State Retirement and Pension System, Administrative Fees, Amendment number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Move to concur with the Senate amendments.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 803 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change your vote? If not, the clerk will take the call. There be 138 votes in the affirmative. House Bill 803, having received the constitutional majority, is declared passed. Concurrence calendar number 18. The clerk will read the bill and the Senate amendments.
House Bill 556, Cannabis Reform, Amendment number 1.
Recognizing the committee chair.
Thank you, Madam Speaker. Amendment number one is technical. Amendment number 2 conforms the House bill to the the Senate bill we just reviewed. Please move the amendments.
So you're saying you're concurring with the Senate amendments?
Apologize. Concurring with Senate amendments.
You want to say that again?
Thank you, Madam Speaker. Move to concur.
Question for the House is to concur with the Senate amendments. All in favor signify by saying aye. Opposed? The ayes have it. House Bill 556 is on third reading and final passage.
Madam Speaker.
Thank
you, Madam Speaker. We had some debate about the Senate version of the bill. Once we vote on this bill, the Cannabis Reform Act will effectively become law. I won't bore you with making the same arguments on the Senate bill that I assume we will pass later today, because by that point in time it will be superfluous. I would very much like to vote for this bill. I would really like to vote for this bill. Society evolves, and society has evolved on the use of marijuana or cannabis. My position on that has evolved as well. I think I've noted for the record, in fact, I sponsored a bill this year that the vast majority of you, with the exception of a few of my caucus colleagues, had the good sense to pass the bill that actually extends and treats cannabis-related businesses for economic development incentive programs the same as any other business, because I believe that there are many, many people in this space who are just simply business people out trying to provide a lawful product and trying to do the right thing, and they should not be penalized because they have the word cannabis in their business. But the expansion of cannabis in our society has to be reasonable, and it has to be responsible, because we have to acknowledge the fact that this is an intoxicating substance. It is a substance that can be abused. It is a substance that has downsides, much as alcohol does, much as tobacco use does, much as other substance use does. It is something that has historically been illegal in every part of this nation, and it still remains today illegal in federal law. We can't change that. We are authorizing people to conduct a business that by its very nature is a federal criminal offense. Whether that's right or wrong, we can't change that. What I would suggest to you is I don't think this bill is well intended as it was. It's got some great parts to it. There are a few parts to me that are not reasonable and are not responsible. We heard the debate this morning about zoning, 500 feet. This bill will allow, your localities will still have some control over where they place these dispensaries or other businesses, but it will allow them to be 500 feet from a school, from a playground, 500 feet. You might have noticed, my friend, I only know one engineer in this body. There might be more, but I only know one, the gentleman from Cecil County. Whether he's a good engineer or not, we're not sure, but he's a better engineer than what I am. And you may have noticed that he and I actually walked the chamber, and then we walked the back room. Now, I trust his calculations. I think he can do the math. And what we've indicated is that it's about 100. If you got up in the back row where the good folks from Carroll County sit, and you walked down there, and you walked out the room, and you came out the side entrance, you're at 100 and some feet. If you went out the front door and down the steps and hit Lawyers Mall, you're getting really close to 500 feet. If you cross Lawyers Mall, you've definitely hit 500 feet. That's just to show you what we're talking about. You're sitting here, this is your kid's school, and on Lawyers Mall is a marijuana dispensary. If you're okay with that, if you think that that makes sense to allow that, then go ahead. I mean, everybody's going to vote for the bill. I get that. Or everybody with certain predispositions can vote for the bill. But that doesn't make sense. That doesn't make sense. Because we make something legal doesn't mean that we normalize it to children. It doesn't mean that we accentuate it to children. It doesn't make sense. We could have done better on that. I have some concerns about the number of licenses. The concerns about the number of licenses is not to prevent minority-owned businesses and small entrepreneurs to get into this field. It is not. It is, in fact, to give them a fair chance to succeed when they get a license. A license is useless if it winds up 2, 3, 4, 5 years ago, the marketplace in which you are licensed to operate goes bankrupt. And I would suggest to you that at the population size that we have, having up to 100 growers with up to 300,000 square feet of canopy and having 300 or more dispensaries spread across our 24 counties is going to be so much marijuana that the price will inevitably reach a point that it's not economically feasible. And some people say, good, cool. Some people on my side of the debate say, that's fine, that's the free market. Let them get in, let them fail. But I will suggest to you when we create a licensing scheme, which we know is going to lead to the potential failure of some of the licensees, that doesn't make sense. To flood the market, because let's remember what marijuana is. You can't sell it across state lines. It's illegal. You can't grow it here and say, well, gee, there's just not enough. There's too much product for the I-95 corridor to absorb, so I can sell it into Virginia. No, you can't. I can sell it into D.C. No, you can't. I can do something this way. No, you can't. You have to sell it here. And if there's just not enough consumers to absorb that at a price, the price goes down, 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 down. The margins go down, 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 down. We're talking about have any of you that may have medical cannabis growers, medical cannabis dispensaries in your jurisdiction, have any of you come to and said, you know what, there's just not enough of us. The demand is so high, we can't grow enough pot. It's so high that people are just running in and out of our dispensaries every 5 minutes. They can't get enough. We're just overwhelmed with customers. We have lines around the block. I can tell you the truth. In my legal practice, I've represented a dispensary lawfully in connection with a transaction where they sold their dispensary. I have a lot of friends in the legal industry that represent growers and dispensaries, and I can tell you this, there's not a single one of them that will tell you that. Not one. Not one of them will tell you we don't have enough pot to sell. We don't have the market has overwhelmed us. Not one. Many of them, in fact, are struggling today. And we are, in some cases, quadrupling the competition in the field. And what that will mean, we will feel good. We'll feel good. We got a social equity applicant. We'll take a picture. The picture will look like a lot of social equity applicants are in the field. They have the business. And 2 years later, 3 years later, 5 years later, 8 years later, if we ever look back, I found in my 9 years here, oftentimes we just never look back. We pass the bill. We have the ceremony. Nobody looks back. We move on to the next issues. We don't realize what has been wrought 5 years in the rearview mirror. But if we look back and we say, hey, half of those social equity applicants that got dispensary license failed. And that turns me to pretty much my last point, and that's about the transferability of the licenses. And you heard my colleagues from Baltimore County ask some questions about that earlier today. To suggest that someone is going to get a social equity license this year for a medical cannabis dispensary, and then after they get the license, when they first get the license, but before they operate, they have a limited period of time that they can transfer a certain portion of their interest. You know why? So they can make money. Because I got to tell you, I don't know how many of you know people that own a local mom and pop. You know, my friend from Charles County said that we want these to be mom and pops. You know anybody that owns a mom and pop liquor store? Just one. Just one mom and pop. They don't have a chain. They're not Total Wine and More. They don't have the biggest Hughes liquor store in the county. They just have a mom and pop liquor store. I've represented lots of guys and families that have mom and pop liquor stores. I got to tell you, they're not getting rich. They're middle class. Some of them a little bit more successful than that. They work hard, usually them. A lot of times their kids, as they become adults, work in the store. They're not getting rich. And we talk about we want to do this to create generational wealth for a class of people that has been excluded from that. Well, the way that you do that is you allow them to build a business, to get a license, and to alienate or transfer or sell that business to people who have more money, more capital, and more ability to move that product. There's a reason why Anheuser-Busch is a Fortune 500 company, And while your local, small, but semi-successful microbrewery is not, there's a reason why R.J. Reynolds is a Fortune 500 company and somebody trying to grow their own tobacco and roll it in their backyard and sell it to you is not. It's called economics. And that is the same thing that is going to happen to this industry. It is the same thing. It's not about social equity. It's not about do you like marijuana, do you not like marijuana. It's about you're creating the legalization of a product that's never been legalized, and you're creating a market for it that is askew with respect to normal economic signals and how production and how sales and how operations work. And for those reasons, I oppose the bill. I hope the bill works. I hope that we get to a good place on cannabis where it is not something that is bad, where it is not something that is causing problems, where it is not something that is inundating our children. It is not something that is causing more accidents and more deaths on the road. I hope we get there. I know my friend wanted this bill to go there, and I appreciate his intent, but I'll vote red on the bill because I don't think it meets those objectives. Thank you, Madam Speaker.
Is there any further debate?
Madam Speaker.
I was going to call on the chairman to he stood up.
I was going to allow young lady to go before I went.
Okay. Gentlelady from Baltimore County.
Thank you, Madam Speaker. I want to thank the chair for coming over to ask me if we were interested in amending the Senate bill that we just discussed. But the cake is baked on this, and so maybe I should say the brownie's baked on this. And you know, I also wanted to support this bill. Voted for this when it came across the first time. It's important. We told voters that they would have the ability to buy recreational marijuana July 1st. And I just think this bill is going to make it too cumbersome to make that happen. I did have a couple of additional questions and then just a comment for the chair. The licensure for dispensaries, was that 10% of gross, or did you guys change that in the concurrence here?
Yes, we changed it.
To
8%.
8% of gross profit.
Yes.
So, for instance, I just did some back of the envelope math here. So $100, you know, a dispensary brings in $100. The product costs them $30 to buy, but because the federal government won't let businesses deduct normal expenses because it's a controlled substance, they can't deduct their anything related to selling the marijuana. So that means they can't deduct their employees, their electricity, the rent, the equipment, the packaging, the security cameras, unemployment, workers' comp, you know, anything related to selling. So, you know, a rough estimate on that might be $60 of the 100. That leaves $10 in quote profit, and then they have to pay 8% of that, $8. That leaves this business $2. And, you know, there's other expenses on the side that they cannot write off. So I think this license fee is really going to prohibit the very people that we want to get into this market to be able to get into the market, because when they go to get a capital investment, investors make a business plan, the plan doesn't work. And finally, I will say that there's one thing that we're doing here as a legislature. We're sending a message to the business community that Maryland is willing to change the rules at any point. In this particular space with the medical cannabis, the rules were changed. People came in, they bid on, they put proposals in, they changed the rules. They came back and did it again. And now they're changing the rules yet again. And I think it's just bad business policy to tell people that the legislature's willing to change the rules on you at any point. Good luck finding investors, good luck finding businesses that want to make long-term commitments here, because we're sending the wrong message. So I agree with the minority leader. I am very hopeful this works, but I'm a realist, and I'm sure we'll be back here next year hopefully with the bill that comes in January, that we can get out of here by February and fix the problems that this bill is going to create. Thank you, Madam Speaker.
Madam Speaker.
Yes, gentleman.
Just one
Mr.
question for the chair, if I could.
Committee Chair.
So on the Senate side, can you talk about what they did in regards to the taxes? In particular, did they increase to keep it the same, or did they decrease the amount that their local governing body?
They increased it 3%.
Did they? Okay. All right, I appreciate that. And that's actually a good thing. And I'll be voting for the bill actually this time for a couple reasons. One, prohibition doesn't work. It never has, and I don't know that it ever will. Throughout the entire state and in all of our districts, folks overwhelmingly supported the legalization of recreation cannabis. And if I go back home, the only caveat that folks back home had considered to us when we talked to them is that, well, you know what, you can tax the heck out of this stuff in order to do it, and it's highly regulated in the process too, so folks know what they're actually consuming. And I think the tax part, and I'm happy that they did that, and that's part of the reason why I didn't vote on the House version, is because it did not give the local governing bodies enough resources to be able to enforce this law. And I hope that whatever the Senate did is enough to do just that. So I appreciate the answer, and I'll certainly be voting green on this bill. Thank you, Madam Speaker.
Chairman.
Thank you, Madam Speaker. I would ask my colleagues in this body to please support this bill. Obviously, it's been a lot of hard work for some individuals in this room, but I want to address some of the misconceptions that we've heard today. We talked about advertising, and well, why can't you put a billboard up? Well, it's weird to say this is all about the kids, but then want you to be able to put a marijuana billboard up, because that you can advertise by this bill, but you have to know that at least 85% of those viewers, or reason to believe that 85% of those viewers are over the age of 21. Because again, I keep hearing my colleagues talk about how bad this is for children. Yeah, and we don't want to advertise to children. We don't want SpongeBob with a joint in his mouth and say, well, let's advertise it because that's my logo, which is why we regulated advertising. You can advertise, but you can't be reckless, and I don't need to see it, nor do my children. We talked about the changing of the rules. We've changed the game. We're not playing. This is not medical marijuana. This is recreational marijuana. We have ended that as we have a right to by the state. There is no longer a medical marijuana program. There are medical marijuana card holders. They can get medical marijuana, but it all comes from a recreational facility. We haven't changed the game. Excuse me, we've changed the game. We haven't changed the rules. And I say that because there's this misconception that these people that got in the beginning of medical marijuana, they invested so much money, and they're being treated so unfairly. Oh, you mean the people that leapt to the front of the line and left a lot of other people behind? I don't want to start talking about how many of us feel about that medical marijuana program that was set up and how unfair it was, and we've had to go back time and time again to change it. So the very people that benefited by being at the front of the line are now whining because we have to regulate them, because they can't do exactly what they want, when they got a benefit not too many people got. And they did it not because they thought medical marijuana was the next going thing, because they were speculating. They knew this day would come. So it is offensive to hear complaining that somehow, some way they're being mistreated and they're going to lose a little money. They're going to have to pay a little money. And remember, that's a conversion fee. It's not a yearly fee. So when we talked about the dispensaries, we worked through that. And we gave them 18 months to pay it. Because you're right, that $2 or whatever you talk about, I'm horrible at math, so I take your word for it. We stretched this out over time. Because best be known that all the folks that participate now got a hell of a start. A huge leapfrog over the people that are going to start, if we're lucky, in a year to a year and a half. And so, yeah, they got to pay something to come over because they speculated, they benefited, and many people got left out of that first and second round. We're going to do better. We talked about zoning. God, it's the floor, not the ceiling. We said a minimum of 500 feet. I pray that your county does what they want to do, because he talked about a very our minority leader talked about a very confusing distance of measurement from the bathroom to the ceiling and I tried to follow him, I couldn't, but I got you. I'm not a math guy. Whatever your measurement was, I believe you, and I took you at your word that from that bathroom to that door to the lawyer's mall is 500 feet. I got it. But my point is, your elected officials on your local level get to decide within reason. Clearly, a mile is too much. You may believe that 500 feet is too small, and you get to decide that because you put those folks in office. We merely said, hey, no less than 500 feet. You can do as much as you want within reason. We talked about the number of licenses, and I appreciate my colleague talking about, because it's a tough pull to try to figure out. The study we did says currently the current amount of medical marijuana sold would cover 8% of the recreational. Because what my good colleague failed to do is he continues to compare the amount of consumption from the current medical to the recreational. And granted, even if whether you imbibe or not, it's going to go up. And it's going to go up substantially. And there are plenty of people that don't imbibe in marijuana, or not as much, because it is illegal. So once that market opens, we cannot question that it will increase. Like I said, by the numbers from the study that we paid for, we're only providing 10%. Now, we kind of took that with a grain of salt. We picked a number, but know this. These licenses are not all being given out tomorrow or even next year. They'll be trickled out over time with continued studies to make sure we're meeting the demand, that we're equitable, but that we're not inundating the market, because we don't want to do that either. We talked about transferability versus being bought out. At the end of the day, my colleague was talking about the liquor store. He's talking about these are not millionaires, and he compared it to Anheuser-Busch. Well, I was trying to create those middle-class folks. That liquor store, their kids are going to own that too. Those mom and pop stores, those aren't bad. Those are actually the goal. They're sustainable. Your kids can inherit. That is the very definition of that wealth that we're looking for, the generational wealth. Because we all don't get to be Anheuser-Busch. But we can create a lot of those mom and pop stores, and we can have them, again, the participation can be very equitable. So again, I think we're kind of missing the mark here. And lastly, I hate to say this, but it's our job. We have to have a regulated market. Owners, they can't just do whatever they want to do. We can't let them advertise. And we see where this goes when we allow people to put their business where they want, to put their advertisements. We understand, we've all seen those old Coke 45 billboards, and they're only in certain communities. We need to avoid that this time. We're trying to learn from the mistakes of the medical marijuana program, the past liquor store issues that we've had. This is not the perfect vehicle, but it's best we can do with the information that we've had. This was not taken lightly. This wasn't done as a joke. We didn't take anybody, try to benefit anybody over anyone else. We try to do something here for Maryland. And you're right, we will probably be back next year. But don't let perfection be the enemy of the good. We have put thought in this bill. We have tried to include as many people into this bill. We want to make sure that we create the access that we can, and that we on July 1st can fulfill our duty to our citizens who apparently wanted recreational marijuana, and it has to be available. And I'll say this. It was a battle from all sides, because there are a multitude of people that thought it was highly unfair that anybody that had a medical marijuana license can participate July 1. And I had to be the bad guy to a lot of people that look like me, because I knew we also had to provide something for the market on July 1. So for all those reasons, I ask you to please vote green on this bill.
Is there any further debate?
Madam Speaker.
Yes, gentleman from...
So there's probably maybe no one in this legislature that's more pro-cannabis than me. I own a cannabis-adjacent business, not only with respect to my hemp company, but I also am involved in the medical marijuana marketplace. I voted for the first cannabis bill. I'm going to be voting no on this bill, and I'll tell you why I'm voting no on this bill. And not because I'm anti-cannabis, but what I am is anti-changing the rules and putting the entire hemp industry out of business in Maryland come July 1. Right? Come July 1st, we're going to put the entire hemp industry, a federally legal industry, out of business. Now, I want to make distinction. You know, there's been a lot of discussion during this process, and I appreciate the chairman for his work in this process. Not all of hemp is intoxicating. There's been some discussion, some push, frankly, by big multi-state operators, cannabis operators, that are simply saying that every hemp product is going to get you high. This bill addresses one thing, addresses tinctures, and I appreciate the chairman for working on that. But that is a small part of the hemp marketplace. The hemp marketplace includes gummies, it includes other forms of vapes and other ways to consume hemp that are not intoxicating, that do not have THC in them. Those are all going to be illegal. It was a $300 million industry last year to the state of Maryland that we are going to slam the door on come July 1st with a federally legal, non-intoxicating industry. We worked hard, my industry worked hard to try to get some sunset provisions in place inside of this bill just to allow an off-ramp, right, to allow us to participate. Because as the good chairman said, we're going to trickle these licenses out. We're not going to give these licenses out tomorrow. We're not going to give them out July 1. We're not going to give them out December 1st for many people. We asked for some sunsets just to allow us to wind down leases, to wind down our business model so that we could participate in the new business model. That was denied. I really, really, really wanted to vote for this bill, but I can't vote in good conscience to kill a legal $300 million industry, frankly, that looks way more like the state of Maryland than our dispensary industry does. You know, the good chairman can tell you, it is a very diverse industry, the hemp industry. Many women, many minorities, many other folks own these businesses because it didn't cost $1 million plus to start a hemp business. And now many of these folks have created very successful businesses. You know, the president of our association is a dreamer. He came to this country many years ago, not legally. He's now a legal citizen. He's got 3 stores. He's doing $1.5 million a year with no high school degree as a dreamer because he was able to participate in an industry that didn't cost, $2 million to access. So I think it's frankly laughable that we're going to put a non-intoxicating industry out of business while we're legalizing an intoxicating industry. I appreciate, though, the chairman's work on the bill. I appreciate the chairman for being willing to listen to us, but I'm going to be voting no on this bill.
Any further debate? If not, House Bill 556 is on third reading and final passage. Clerk will call the roll.
Madam Speaker.
Has everyone recorded their vote? Does anyone care to change their vote? If not, the clerk will take the call. There being 104 votes in the affirmative, House Bill 556, having received a constitutional majority, is declared passed. Report of the Committee on Appropriations, report number 23. Clerk will read the bill.
Senate Bill 442, Economic Development, Sports Entertainment Facilities, Financing, and Construction. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered passed for third reading. Report of the Committee on Environment and Transportation, report number 33. The clerk will read the first bill.
House Bill 2826, Statewide Rental Assistance Voucher Program, Establishment. Favor the amendments. Amendment number 1.
Madam Speaker.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
The committee amendments conform this bill with SB 848, which was as amended and passed by E&T earlier today. The amendments make a technical correction for foster youth and also reduce the mandated appropriation to $10 million. Move the amendments.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. Amendments have been adopted. Question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read next bill.
House Bill 1291, Maryland Zero Emission Electric Vehicle Infrastructure Council. Membership. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Thank you. Amendment number 1 is technical, and amendment number 2 adds a representative of the Department of General Services to ZEVIC, the Zero Emission Electric Vehicle Infrastructure Council. Move the amendments.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. Amendments have been adopted. Question now the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read next bill.
Senate Bill 848, Statewide Rental Assistance Voucher Program Establishment. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
These amendments are identical to the House bill amendments that we just passed 45 seconds ago or so. It's a technical fix related to foster youth, and it's an altering of the mandated appropriation. Move the amendments.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Appropriations. Report number 24. Clerk will read the first bill.
Senate Bill 24, Department of Transportation, Financing and Commission on Transportation Revenue and Infrastructure Needs, State and Federal Transportation Funding Act. Favorable amendments. Amendment number 1.
Recognizing floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
There's one amendment. It makes changes to the commission in the bill. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed? The ayes have it. The amendments have been adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 239, State Employee and Retiree Health and Welfare Benefits Program, Domestic Partnerships. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Clerk, read next bill.
Senate Bill 944, Maryland Historical Trust, Warner Mansion in the town of Kensington, extinguishment or termination of easement. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed? The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered past the third reading. Report of the Committee on Environment and Transportation, the bill that was previously special ordered. It's report number 31. Maker of the special order.
Thank you, Madam Speaker. It's a study bill. I did not have a cross file. I have no questions on the bill.
Okay. Is there any other debate or anything? Hearing none, the Senate Bill 830 is ordered past the third reading. That ends the work at the desk. Committee announcements, appropriations.
Appropriations will not meet in between sessions.
Judiciary.
Thank you, Madam Speaker. Ladies and gentlemen, the House Judiciary Committee will have a voting session at 12:30.
Environment and Transportation. Vice Chair, I'm sorry.
Madam Speaker, Environment and Transportation will be meeting at time to be determined, which we will follow up with committees on. Thank you.
Okay. Ways and Means,
Thank you, Madam Speaker. The Ways and Means Committee will not meet between sessions.
Economic Matters,
Thank you, Madam Speaker. I believe the House Economic Matters Committee will have a brief voting session as soon as we get off the floor.
Health and Government Operations,
Thank you, Madam Speaker. The Health and Government Operations Committee will meet at 12:30 for a hearing and 1 o'clock for voting. Thank you.
are there any subcommittee, rules?
Madam
Okay,
Speaker.
give it.
Madam Speaker, I'd like to have the Environment and Transportation Committee meet in the committee room at 12:30 to vote.
Rules,
Thank you, Madam Speaker. Ladies and gentlemen, there will be a very brief meeting of the Rules Committee in the old chamber immediately following this session, and we will have just a couple bills, Senate bills, to move out. Thank you.
okay.
Just a vote change.
Who's getting up? Gentleman from Calvert.
Thank you, Madam Speaker. House Bill 44A to read. Thank you.
Any other vote changes? Yes.
Thank you, Madam Speaker. House Bill 874 to read. Thank you.
Any other vote changes? Okay. All right. Where am I at? Was there any subcommittee announcements? Nope. Any delegation announcements? Any caucus announcements? Any personal or guest announcements?
Yes, Madam Speaker.
Yes. Excuse me.
Madam Speaker, permission to use delegates' names?
Permission granted.
Thank you, Madam Speaker. Today is a special day. It is the birthday of a special person. This person gives abundantly. She listens with her heart, brings out the best in people, looks past one's flaws and faults, and loves unconditionally. Delegate Barnes and I wish Delegate Lehman many blessings for a long and healthy life.
Any other personal or guest announcements? Yes. Gentleman. Oh. Yes.
Thank you, Madam Speaker. Permission to use the delegates' names?
Permission granted.
Thank you. I have a few amazing leaders that I'm going to recognize today, so I appreciate that we got that out of the way. Today, colleagues, is a bit of a bittersweet day for me, because today marks the last day that I will be able to speak on the floor as president of the Women's Legislative Caucus. And it's truly been an honor to serve the women of this legislature, and I'm so forever grateful for your support and your confidence. I'm also forever grateful to the trailblazing women who fought so hard for this caucus to exist in the first place, and also the women who fought to ensure that we could have a record-breaking number of us here, 80 in both chambers. But the bittersweet turns to just sweet when I think about what is yet to come for our caucus and about the announcement that I'm about to make. It has been noted many times that our caucus is the oldest in the nation, but I'm here to tell the chamber we are also the most successful. You see, most women's caucuses have a ceremonial purpose, but our leaders are here to work together and to move policy. Women's leadership is often collaborative. That's one of our superpowers. And we usually don't get a chance to toot our own horn. Well, usually. Today, as a point of personal privilege, I'm going to take a moment to brag outright about some of our members and to briefly tell you the story of our session. Last spring, colleagues, at the height of the baby formula crisis, our caucus partnered with student computer programmers to launch a site that helped nearly 100,000 parents in our region find baby formula. Then we worked with local and national leaders to help nearly 300 women apply for full or partial student loan forgiveness for their public service. Then during the election cycle, we asked all the statewide candidates to commit to gender parity in their appointments if they were to be elected. And Governor Moore, to his credit, committed very easily. And thankfully, under the leadership of Delegate Michelle Guyton, who developed a talent pipeline, we've been helpful in helping him keep that commitment. Under the leadership of Delegate Dana Jones, our members contributed more than 1,000 household items for domestic violence survivors that live in all of our districts. With the help of our great staff, our executive director, Valerie Graham, and our intern, Anjana, we organized events to welcome our new members in this unique sisterhood of being a woman in the legislature. During our 50th anniversary, we honored our trailblazers before us, like Chair Maggie McIntosh, Senator Dolores Kelly, Senator Addie Eckert, and Secretary Kelly Schultz. We also have been joined by former Women's Caucus presidents, Congresswoman Connie Morello and Lieutenant Governor Aruna Miller. During session, we partnered with the Legislative Black Caucus and the Latino Caucus to uplift our mutual priorities, like addressing economic disparities in criminal justice. Because after all, colleagues, we're all in this together. With the vision of our speaker and the leadership of Delegate Nicole Williams, our caucus took the bold stance to support reproductive choice for the first time in 4 decades. And if there's anything this chamber remembers from what I say today, is that I want you to know every single bill on the Women's Caucus policy agenda moved. That isn't luck, it's leadership. And it's a testament to the brilliance and the excellence that our members possess. And so now, I have the honor of announcing a new lineup of leadership for our caucus. I want to thank our departing members, Vice Chair Bonnie Cullison, who has tirelessly led our Legislative Review Committee for many years. You can give her applause. And I want to thank Delegate Heather Bagnall, who is so committed. She once joined us for a Zoom meeting at the top of the Eiffel Tower. And now for the new rules. First, I want to congratulate Delegate Edith Patterson, our new president. Anyone who has participated in one of her 7 Women's Veterans Day events knows that her standard is excellence and that we are in very good hands. President-elect is Delegate Nicole Williams of Prince George's County. First Vice President Dana Jones of Anne Arundel County. Second Vice President and Chair of our Child Care Work, Delegate Michelle Guyton of Baltimore County. Secretary is Delegate Brooke Grossman of Washington County. Our treasurer, someone who has sat next to me for the past 5 years, Delegate Pam Queen of Montgomery County. Member at large and chair of our events program, Delegate Jennifer White of Baltimore County. And last but not least, member at large and chair of the Legislative Review Committee, Delegate Linda Foley of Montgomery County. Colleagues, to improve is to change, and to perfect is to change often. And to that end, we have changed and modernized our bylaws, so starting next year, the presidency will last 2 years. We will, however, keep the tradition of welcoming members of all parties, all genders, and all chambers. Colleagues, in closing, coming together is just the beginning. Staying together is progress, but working together is success. Thank you to everyone who has made this session successful to our caucus and will continue to make our caucus successful. Our doors will remain open to anyone who wants to work together. Thank you.
Are there any other personal or guest announcements? Yes. Gentleman from Baltimore County.
Okay, with not nearly as much gravity as that last announcement, and permission to use some delegates' names, please.
Permission granted.
Okay, so Delegate Holmes will tell you that he has the Seersucker Caucus, and it's a great tradition. We are establishing a new one over the last several years, and this is extended not just to those of us who wear ties on a regular basis, but to the very people that were just talked about a moment ago who might want to wear a tie on the last day. None of us would wear a tie 2 days in a row. There will be several legislative days on Monday, so I entreat you to wear a tie, but bring an extra one. So at adjournment, we will change our ties, so we'll have a new tie on for the next day. It's called Sine, guess what? Tie, right. I encourage you all to do it. I'll remind you again, I didn't want to wait till the second session when you were all running out. Thank you very much.
Okay. Are there any personal or guest announcements? Okay. If not, quorum call before adjournment.
Madam Speaker.
Has everyone recorded their presence? House is still in session. Recognizing the majority leader.
Thank you, Madam Speaker. First, colleagues, the chamber will be locked, so you can leave your things. And with that, I move the House stands adjourned until Saturday, April 8th at 2:30 p.m., Legislative Day, March 31st.
2:30 p.m.